potty training. Just those two words can make parents feel overwhelmed, stressed, and confused. You've heard about the 3-day method, the child-led approach, stories of kids trained at 18 months, and tales of 4-year-olds still in diapers. You're wondering, what's the right way? What works? And most importantly, how do I avoid turning this milestone into a battlefield? In this video, I'm breaking down the most popular potty training methods, revealing what science says about readiness, sharing how different cultures approach this transition, and giving you practical strategies to handle accidents, regressions, and those dreaded power struggles. Whether you're just starting to think about potty training or you're in the middle of a messy struggle, this guide will help you find the approach that fits your child, your family, and your sanity. Before we dive in, hit that like button, subscribe to Little Nest Guide, and ring the bell so you never miss essential parenting guidance. Let's make potty training less stressful and more successful. Let's start with the two most talked about methods. The 3-day intensive method promises rapid results. The idea? Clear your calendar for a long weekend, ditch the diapers completely, keep your child naked or in underwear, and focus intensely on potty cues. You're watching constantly, offering the potty every 15 to 20 minutes, celebrating successes, and staying consistent through accidents. Advocates say this immersion approach helps children make the connection quickly because there's no confusion between diapers and underwear. The science? Intensive methods can work when a child is developmentally ready. The concentrated focus and immediate feedback help children understand cause and effect quickly. However, this approach requires true readiness. If your child isn't physically or emotionally prepared, 3 days of pressure can create resistance, anxiety, and setbacks that last months. Now, the gentle child-led approach takes the opposite philosophy. You follow your child's pace, introduce the potty gradually, let them sit when they want, celebrate interest without pressure, and keep diapers available as a backup. This method respects individual timelines and reduces stress for everyone. The downside? It typically takes longer, weeks, or even months, and requires patience when your child seems uninterested. Here's what matters most. Neither method is inherently superior. The 3-day method works beautifully for children showing clear readiness signs, for families who can commit fully to the intensive period, and for children with temperaments that respond well to structure and routine. The gentle approach works better for children who resist pressure, for families with demanding schedules who can't dedicate 3 straight days, and for children who need more time to process changes. The biggest mistake parents make? Choosing a method based on what worked for a friend's child or what sounds easiest, rather than assessing their own child's readiness and temperament. Match the method to your child, not your timeline. Here's something that might surprise you. In many parts of the world, children complete potty training by 12 to 18 months, sometimes even earlier. In China, traditional elimination communication starts in infancy. Parents learn to recognize their baby's cues and hold them over a potty or appropriate place. In parts of Africa, babies are often trained by 12 months because diapers are expensive or unavailable, forcing families to tune into natural elimination patterns. In Vietnam, mothers make a whistling sound when babies eliminate, creating a conditioned response. By 6 to 9 months, many babies associate the sound with going, and training happens naturally and early. Even in parts of Europe, particularly Eastern Europe, potty training by 18 months is common and expected. So why do American and Western children typically train between 2 and 3 years old, sometimes later? Several factors. First, the invention of highly absorbent disposable diapers reduced urgency. When children stay dry and comfortable in diapers, there's less natural motivation to change. Second, cultural emphasis on child-led parenting means we often wait longer, prioritizing emotional readiness over early training. Third, our busy lifestyles make the intense observation required for early training difficult. Those cultures with earlier success often have extended family support, different work structures, or communal childcare that allows constant attention to elimination cues. What can we learn from these cultural differences? Early training is absolutely possible when families commit to observation and consistency. Children's bodies are capable earlier than we often assume. However, context matters. If early training doesn't fit your lifestyle, family structure, or values, that's completely fine. The goal isn't to compete with other cultures, but to find what works sustainably for your family. If you're inspired to try earlier training, start with observation. Spend a few diaper-free periods watching for patterns. Notice when your child typically eliminates. Introduce the potty casually and build positive associations. You might be surprised at your child's capability when given the opportunity. This is critical. Most potty training struggles happen because parents start before their child is truly ready. Readiness isn't just about age, it's about development across 3 key areas. Physical readiness means your child's body is capable. Signs include staying dry for 2 hours or more, having regular, predictable bowel movements, showing physical signs before going like squatting or hiding, being able to pull pants up and down, and having the bladder and bowel control necessary to hold and release intentionally. If your child is still eliminating every 30 minutes, their bladder simply hasn't matured enough yet. Emotional readiness means your child is psychologically prepared for this change. Look for signs like expressing discomfort with dirty diapers, showing interest in the bathroom or in wearing underwear, wanting to please you and feeling proud of accomplishments, and being in a relatively stable emotional phase, not during major transitions like a new sibling or moving homes. A child in a clingy, anxious, or resistant phase isn't emotionally ready, no matter their physical capability. Cognitive readiness means your child understands what's expected. They should be able to follow simple 2-step instructions, understand words related to bathroom functions, communicate when they need to go either verbally or through gestures, and recognize their body's signals before elimination happens. If your child doesn't yet connect the feeling of needing to go with the actual act, they're not cognitively ready. Most children show all 3 types of readiness between 24 and 36 months, but there's huge normal variation. Some children are ready at 20 months, others aren't ready until 3.5 years. Both are completely normal and healthy. The dangerous habit many parents fall into is starting training based solely on age or external pressure. Grandparents commenting, preschool requirements or comparison with other children shouldn't drive your timeline. Starting before readiness creates frustration, power struggles, and can actually delay ultimate success. Wait for the convergence of physical, emotional, and cognitive signs. When all 3 align, training becomes dramatically easier and faster, regardless of which method you choose. Here's what many parents don't realize. Night training and day training are completely separate milestones with very different timelines. A child can be fully day trained and still need nighttime diapers for months or even years. Why? Because nighttime dryness depends on physical maturation that's largely out of your child's conscious control. During the day, your child can recognize the urge to go and take action. At night, their brain needs to either wake them when the bladder is full or produce enough antidiuretic hormone, ADH, to concentrate urine and reduce production during sleep. These mechanisms develop on their own timeline, usually between ages 3 and 5, but sometimes as late as 6 or 7 years old, especially in boys. The approach for day training involves active teaching, consistency, frequent reminders, and lots of practice. You're building a new skill and habit. The approach for night training is completely different. You're waiting for physical maturity while supporting your child's confidence. For day training, start with the basics. Frequent bathroom trips, every 1 to 2 hours at first. Dress your child in easy-off clothing. Use positive reinforcement for successes and calm, neutral responses to accidents. Stay consistent with your approach and expectations. Most children achieve daytime control within weeks to a few months of starting when they're truly ready. For night training, start by limiting drinks 1 to 2 hours before bedtime and ensuring your child uses the potty right before sleep. Some parents successfully lift their child to use the bathroom during a late-night parent bathroom trip. However, if your child is still waking up soaked regularly after several weeks of day training success, their body simply isn't ready for nighttime dryness yet. Here's the critical part. Do not shame, pressure, or punish for nighttime accidents. This is developmental, not behavioral. Continued nighttime wetting is genetic. If you or your partner wet the bed past age 5, your child is much more likely to as well. Use waterproof mattress protectors, keep nighttime pull-ups available without shame, and reassure your child that their body will figure it out when it's ready. The biggest mistake? Treating night training the same as day training. This creates unnecessary stress and damages your child's self-esteem over something they genuinely cannot control yet. Focus your energy on day training. Let nighttime dryness develop naturally with support, but without pressure. You celebrated. Your child was trained, using the potty consistently, maybe even staying dry at night. Then suddenly, accidents, lots of them. This regression can feel devastating, but it's incredibly common and usually temporary. Regressions typically happen for clear reasons: new sibling arrival, starting preschool, moving homes, parents separating, illness or urinary tract infections, developmental leaps that temporarily affect other skills, or simply testing boundaries and asserting independence. When children feel stressed, overwhelmed, or are processing big changes, potty training skills often slip. The worst response? Punishment, shame, or anger. This creates a negative association with the bathroom and can deepen the regression into a longer-term problem. Remember, regression is communication. Your child is telling you something is hard for them right now, even if they can't verbalize it. The best response starts with staying calm and matter-of-fact about accidents. Clean up without drama or excessive attention. Temporarily increase bathroom reminders and support, going back to more frequent scheduled sites. Address the underlying stressor if possible. If there's a new baby, create special one-on-one time. If it's preschool adjustment, add extra comfort and connection at home. Rule out physical causes. Urinary tract infections, constipation, and other medical issues can cause sudden accidents. If regression lasts more than a few weeks or includes pain, burning, or other concerning symptoms, consult your pediatrician. Give it time. Most regressions resolve within a few weeks once the stressor eases or the child adjusts to the change. Maintain your calm confidence that your child will get back on track. Your anxiety or frustration will only extend the regression. Consider whether your child might benefit from temporarily going back to pull-ups during this phase. Some children find this reduces pressure and actually helps them recover faster. Others see it as permission to regress further. You know your child best. The key message? Regression is normal, temporary, and not a failure of your training or your child's ability. Respond with empathy, increased support, and patience. Your child will return to their previous success when they're ready. Accidents are not failures. They are an inevitable, necessary part of the learning process. Yet how you respond to accidents profoundly impacts whether potty training becomes a positive milestone or a source of shame and anxiety for your child. When an accident happens, take a breath. Your emotional response sets the tone. If you react with frustration, disgust, or anger, your child learns that accidents are shameful and that their bodily functions are bad. This can create anxiety around using the bathroom, leading to withholding, constipation, and longer-term issues. Instead, respond calmly and neutrally. Use a simple statement. Oops, you had an accident. Let's get you cleaned up. No drama, no lengthy explanations, no visible frustration. Keep your tone the same as if they'd spilled water, matter of fact and kind. Involve your child in cleanup in an age-appropriate way. A 2-year-old might help carry wet clothes to the laundry. A 3-year-old might help wipe the floor. This isn't punishment. It's teaching natural consequences and responsibility without shame. Keep it brief and still matter of fact. After cleanup, offer a gentle reminder. Remember, pee and poop go in the potty. Let's try sitting on the potty now. Sometimes children finish eliminating on the potty after an accident, which still deserves praise. You started in your underwear and finished in the potty. That's progress. Never use punishments like timeouts, taking away privileges, or making your child sit in wet clothing. These tactics damage trust, create shame, and often backfire by increasing accidents through heightened anxiety. Watch your language. Avoid words like bad, naughty, or disgusting when referring to accidents or bodily functions. Use neutral words like wet, accident, or miss instead of negative judgments. Remember, accidents will continue even after your child seems mostly trained. Excitement, distraction, being in a new environment, and simply forgetting all cause accidents in children who absolutely know how to use the potty. Some children have occasional accidents until age 4 or 5. This is normal. Your calm, supportive response to accidents builds your child's confidence and resilience. You're teaching them that mistakes are part of learning, that you still love them unconditionally, and that they're capable of trying again. These lessons extend far beyond potty training. Potty training can quickly become a battleground. Your child refuses to sit on the potty, holds their pee or poop for hours, has accidents that seem intentional, or has complete meltdowns at bathroom time. This is one of the most frustrating aspects of potty training, but it's also a sign that something needs to change in your approach. First, understand why power struggles happen. Toddlers are developing autonomy and independence. Using the bathroom is one of the few things they have complete physical control over. When they feel pressured, controlled, or forced, they instinctively resist. Power struggles often mean you started before your child was truly ready, or your approach has become too controlling, too focused on rewards and punishments, or too inconsistent with mixed messages. The solution: give back control. This sounds counterintuitive, but it works. Stop the battle. Tell your child, your body is yours. You get to decide when you use the potty. I'm here to help when you're ready. This removes the struggle. Most children, when pressure lifts, become curious and willing within days or weeks. Offer choices that empower. Do you want to use the big potty or your potty chair? Do you want to try before or after snack? Should we read one book or two while you sit? Choices create ownership and cooperation. Make the bathroom inviting and low pressure. Special books that only come out during potty time, a sticker chart they control, fun soap or songs can shift the association from battleground to pleasant routine. Check your language and energy. Are you asking or demanding? Are you patient or frustrated? Children sense our emotions. If you're stressed and pushy, they'll resist. If you're calm and confident, they'll feel safer trying. Sometimes the best approach is backing off completely. If power struggles are intense, consider taking a break for 2 to 4 weeks. Put diapers back on without shame or comment. Simply say, "We'll try again later when you're ready." This break often resets the dynamic completely. When you reintroduce training, your child approaches it fresh, without the baggage of previous battles. Remember, you cannot force a child to use the potty. You can lead them to the bathroom, but you cannot make them go. Accepting this reality is freeing. Release control of the outcome. Control only what you can, offering opportunities, staying consistent, creating positive associations. Your child will do their part when they're developmentally and emotionally ready. Power struggles are a sign to change your approach, not to push harder. Listen to what the struggle is telling you, adjust with compassion, and trust your child's timeline. Out of all these potty training methods and strategies, which approach resonates most with you? Are you team intensive 3-day method or gentle child-led? Have you experienced regression or power struggles? What worked for your family? Share in the comments. Your experience might be exactly what another struggling parent needs to hear. Thank you for watching and for caring so deeply about making this milestone positive for your child. If this video gave you clarity, even just one helpful strategy, please like, subscribe to Little Nest Guide, and share this with other parents navigating potty training. Together, we can make this journey less stressful and more successful. Remember, this content is educational only and is not a substitute for professional medical advice. If you have concerns about your child's potty training, development, or any persistent issues with accidents, withholding, or pain, always consult your pediatrician or a child development specialist. May your potty training journey be filled with patience, progress, and plenty of celebrations. Trust your child, trust the process, and trust yourself. You've got this. See you soon on Little Nest Guide.